Giving you the best in gospel music. My name is Brad Rogers.
It's Cheryl Jackson with the best in gospel music. Hey y'all, it's Alicia Ringing.
I'm Matt Anderson. It's your urban inspiration station.
Hey everybody, it's Tracy Morgan. Thank you so much for hanging out with me. Hey listen, this track is so hot.
Come on. We have some hot.
Cheryl
I'm talking
Jackson
about
with the
hot
best
from
in
me to
gospel
you.
music. This is a wonderful hit.
Patrick
Another
Lundy
hit.
and
This
the
one
Ministers
will
of
not
Music.
disappoint you.
Song
I
titled
promise
In
you of
the
that.
Fellowship.
The powerful hit. Patrick Lundy and the Ministers of Music. It's called In the Fellowship.
Don't let nobody stop you. I got a right. You got a right. We got a right to praise him. And you got a right in here tonight. Come on, make some noise.
Hot new single from Patrick Lundy and the Ministers of Music, In the Fellowship. It's happening right now on your favorite gospel station.
How good the brethren and unity. Lift your hand. Come on, everybody. And bless them like you know that you're free. Anybody free tonight? Don't let nobody block you. Nobody stop. I got a right. You got a right. We got a right. Here we go. Behold, how good a brother and unity. Lift your hands, come on everybody, and bless them like you know that you're free. Free indeed. Don't let nobody block. I got a right. You got a right to brag. Here we go, come on. It's okay to make some noise in the house of the Lord tonight. Hallelujah. In the fellowship. Come on, let's take it a little higher. Oh, oh.
This track is so hot, a hit right out of the Washington metropolitan area. Matter of fact, I'm going to go ahead and proclaim it as a hit. It's so hot, you've got to check it out. It's Patrick Lundy and the Ministers of Music, In the Fellowship.
Hey y'all, it's Alicia bringing you the hottest in gospel music. Now we've got a new jam. I'm telling y'all, it's gonna be a hit. Here's Patrick Lundy and the Ministers of Music, In the Fellowship, right here, right now. It's Cheryl Jackson with the best in gospel music. This is a wonderful hit, another hit. This one will not disappoint you. I promise you of that. The powerful hit, Patrick Lundy and the Ministers of Music. It's called In the Fellowship.
There's a woman in a hole. She can't get out. It's a live or die situation, but she's in that hole. And a man walks by, he's a millionaire. He writes a check to her and says, oh yeah, he drops it down in the hole. She keeps the check, she needs the money. But she's still in that hole. And then a minister walks by and she's screaming, I'm in a hole, can somebody help me? And he blesses her. She appreciates the prayers. But then the American Cancer Society comes by, and all of a sudden that person jumps down in the hole. And she says, I just told you I was stuck in this hole. Why would you jump in here with me? And that person says, because I've been in this hole before and I know the way out. They know the way out. They can take you to get chemo. They can give you a wig. They can sit you in a room full of other women or men that are fighting the same battle. They can give you information. They can take you and make sure you're at the right doctor. They know how to get out of that hole.
Ladies and gentlemen, please welcome the American Cancer Society's National Ambassador and host for today's program, Wendy Raquel Robinson.
You've got to unmute. Sorry, you've got to unmute.
Okay. Well, now you can hear me. I'm going to start all over again, and we are definitely live, so that's what happens. So as I was saying, hello, everyone, and thank you for that kind introduction. I'm Wendy Raquel Robinson, and I am so thrilled to be your host this afternoon for the American Cancer Society, as well as the National Ambassador. Now, tonight's program is designed to inform, it is designed to educate, and designed to inspire all of us to partner for life. And tonight, we are increasing your knowledge of how to reduce your risk for cancer through getting healthy eating, through active living, and regular cancer screenings. Now, how many out there know that African Americans bear an unequal burden of cancer? Because if I ask you to raise your hand and tell me how many of you have been touched, by a friend, by a caregiver, or a loved one, almost every hand in this virtual space would go up. You see, unfortunately, cancer has touched all of our lives in some way or another. And so that's why tonight we are partnering for life, for us to save lives, to celebrate lives, and to lead the race and the fight for a world without cancer. Now, partnering with the American Cancer Society on this nationwide campaign to not only raise awareness in the Black community, but we are also offering several national organizations an opportunity to partner with us. And they are also lending their voice and their collective strength to this work. So we are honored to have as partners the African American Episcopal Church, AME, Alpha Phi Alpha Fraternity Incorporated, the Black Women's Agenda Incorporated, 100 Black Men of America Incorporated, Delta Sigma Theta Sorority Incorporated, Kappa Alpha Psi Fraternity Incorporated, the Links Incorporated, the National Baptist Convention USA, the National Black Justice Coalition, Phi Beta Sigma Fraternity Incorporated, Zeta Phi Beta Sorority Incorporated. Now, together with all of these amazing partners, we are delivering life-saving information to our community. Now, tonight's program, it is designed to be a community of fellowship and of sharing. So please share your cancer stories and your testimonies in the comment box below. Now, we also want to hear from you as we create a space for inspiration and for hope. So please share the many ways that the American Cancer Society, as well as the American Cancer Society Cancer Action Network, are working to improve not only the lives of cancer patients and their families, but here is the CEO, Dr. Karen Knudsen, who is going to speak to us furthermore. Thank you.
Thank you for having me, Wendy, and thank you to all of the audience members for being here. I'm Dr. Karen Knudsen, CEO of the American Cancer Society. Our mission at the American Cancer Society is to improve the lives of cancer patients and their families through research, through advocacy, and through direct patient support. Our decision-making places the patient and their family, including their caregiver, at the center. This is intentional. We know that supporting caregivers has a huge impact on the cancer patient. Through research, we've shown that cancer patients who have a caregiver report better overall health outcomes and certainly better quality of life. We also know that caregivers and families play an important role in helping cancer patients improve their overall health behaviors, which help them overcome cancer. This is all the more important as over the last few years, COVID has shown us again and again the challenges of health equity, of racial disparities, and unequal access to care. The solutions are complex, or the issues are complex, and the solutions are certainly not easy. Cancer is a disease that affects everyone, but we know it does not affect everyone equally. I cannot emphasize enough that the American Cancer Society has a deep commitment to health equity, which means that everyone has a fair and just opportunity to prevent and to fight cancer. We know that factors like insurance, limited access to care, and economic inequalities all disproportionately impact people of color. This makes people of color less likely to receive preventative care screenings and less likely to receive an early stage diagnosis, which gives them a greater chance at a positive outcome. The burden in the Black community is higher than in other communities as well. We know again from data that the Black community has the highest death rate and shortest survival of any racial and ethnic group in the US for most cancers. That is profound and also unacceptable. This is why we have been working with the National African American Organization in an intentional way to collectively discuss ways to save and improve lives. We're working with our partners on this event and others to address both the systemic issues as well as other issues related to knowledge gaps that can be solved through research. We are aware and embrace the concept that partnership is a critical part of raising awareness in the Black community and in increasing health equity. Partnership is key for us because if we are going to reduce cancer disparities, we need to listen. We need to listen to the experiences of Black people with cancer, their caregivers, and their communities. We also need to work together to spread the word about the importance of prevention, of screening, of importance of early diagnosis. Our initiative, which is called Partnering for Life, will help us realize our collective goals. I encourage you to please check out our Partnering for Life website. This includes resources about cancer risk, cancer prevention, as well as early detection, all those things we just talked about. I'd also like to encourage this group to please engage with your communities and with the American Cancer Society in this joint fight against cancer. So thank you for listening. Thank you for what you do. And thank you for joining arms with us to improve the lives of cancer patients and their families. I look forward to the rest of the event. Thank you. Thank you.
Thank you, Dr. Knudsen. Thank you for your leadership and for your commitment in addressing cancer disparities and advancing health equity. Now, also joining us tonight are several of our leading gospel artists, and I'm so excited about that. And they are sharing not only their time and talent, but their support in this important cause. So, to set the atmosphere, please join me in welcoming Jonathan Nelson, whose 20-year career has exposed millions across the world to the electrifying sound of praise and urban worship. Jonathan Nelson.
To the American Cancer Society, this is Jonathan Nelson, thanking you for allowing me to be a part of this great celebration. I just wanted to pause just to invite you to have a friend, family member, someone to tell them to come join this celebration. We are about to sing, dance, and celebrate. First, we're going to say we believe the God of miracles, and we're going to say so long bye-bye to all of our pain, to all of our troubles, to all of our cares, and we're going to bless the Lord at all times. We're going to give God a right now praise. I want you to come on in. Let's celebrate. Let's go.
Wherever you are, you could be home. You may be in your car. You may need to pull over, but I want you to get up and I want you to start moving your feet. Come on, it's time to dance. Everybody, come on. Hey, 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 come on, come on. We're going to the islands. I'm talking to every believer that believes that we serve the God of miracles. Come on, everybody. We ain't done yet. Everybody move your feet. Come on. Hey. If you know it, would you join me and say Jehovah? Say it. Jehovah, I trust in you. in you. Oh Lord, Jehovah, I trust in you. Come on, everybody say, I believe. Say it, say it.
I believe,
You are
the God of miracles.
You are the God of wonder.
You are the God of wonder.
You are the God of power.
You are the God of power.
So we say,
I believe.
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 I believe. I believe.
I believe.
Wherever you are, come on, clap your hands. Wherever you are, come on. Come on, ladies, help me say it. Jehovah.
Jehovah,
I trust in you.
in you.
Oh Lord. Hey,
Jehovah,
I trust in you.
in you.
Everybody, come on, say it.
I believe you.
I trust in you.
In you.
Oh,
Jehovah,
I trust in you.
in you.
Everybody say, I believe. Come on, come on.
I believe.
Hey.
You are the God of miracles.
You are the God of wonder.
You are the God of wonder.
You are the God of power.
You are the God of power.
So we say,
I believe.
I believe.
I believe.
I believe.
I believe.
I believe.
I believe. I believe.
I believe.
I believe.
All right, y'all. I know y'all feet hurt. Why don't y'all take y'all shoes off if you can? Let's dance a little bit. Come on. Everybody, wherever you are, come on. Come on. It's time to dance. Come on. Come on. Hey. Come on. It's time to dance. Come on, move your feet, everybody. It's time to dance. I want y'all to find the camera, and I want you to look directly into it. Help me say it. Come on. So long, bye-bye. Hey, so long, bye-bye. Goodbye. Say it real good.
Goodbye to my pain and my sorrow.
So long.
So long, bye-bye.
I can't hear you. You know it. Come on, raise it. Say it. So long.
Bye-bye.
So long, bye-bye. Goodbye to my pain.
Goodbye to my pain and my sorrow.
So long.
So long, bye-bye.
Find the camera. Say it. Say it. So long.
Bye-bye.
It's some stuff and some people you gotta say.
Bye-bye.
Goodbye.
Goodbye to my pain and my sorrow.
So long.
So long, bye-bye.
I'm talking to all the young people out there. Say it. So long.
Bye-bye.
Why don't you move your feet and say it?
Bye-bye.
Goodbye to my pain.
Goodbye to my pain and my sorrow.
So long.
So long.
Hey, come on, everybody say it. So long. Yeah, so long. Yeah, so long. Yeah, so long. Goodbye to my sorrow. Goodbye to trouble. Goodbye to sickness. Goodbye to sickness. Somebody wave me bye-bye. Somebody wave me bye-bye. Somebody wave me bye-bye. Somebody wave me bye-bye. Let's go. So long. Come on, move your feet, everybody. So long. Goodbye to my pain.
Goodbye to my pain and my sorrow.
So long.
So long.
Hey, let's go, let's go. Come on. So long. Yeah, so long. Yeah, so long. Yeah, so long. Goodbye to sorrow. Goodbye to
Wow, so long sorrow. Exactly. No more pain. Bye-bye. Thank you, Jonathan. What a great song to get this everything moving, right? Okay, and now we have a special message from our past National Board Chair of the American Cancer Society, Dr. Cynthia LeBlanc. And following Dr. LeBlanc, we're going to have greetings from all of our partners, including the Honorable Chris Ray, President of Phi Beta Sigma Fraternity Incorporated. And on behalf of the 100 Black Men, we will have Mr. Charlie Hill, Vice Chairman of the International Health and Wellness Committee. Please welcome them.
Hello, I am Dr. Cynthia LeBlanc, former National Board Chair of the American Cancer Society. And as an American Cancer Society volunteer for more than 30 years, I have worked with our staff and volunteers to ensure that our mission reaches all communities touched by cancer. We know that cancer is a disease that affects everyone, but it doesn't affect everyone equally. And that's why the Partnering for Life initiative is so important. Raising awareness and connecting communities to cancer resources is in many ways more important now than ever before. We know that there have been delays in cancer screening due to the pandemic. We also know this may mean worse outcomes due to a late diagnosis of cancer. But we can help change this by encouraging the people we know to talk to their healthcare provider about getting screened. And if there are barriers to getting screened, the American Cancer Society is here to help. We can help with getting persons connected to free and/or low-cost screenings, or providing questions you can ask your doctor to get answers regarding cancer screenings. For more information, please visit cancer.org/partneringforlife for information, resources, and hope.
Hello. I'm Chris Ray, International President of Phi Beta Sigma Fraternity Incorporated. I want to share an important message about the impact of colorectal cancer on the Black community. Despite an overall decline in colorectal cancer cases and deaths over the last decade, Black men and women are still more likely to get the disease and more likely to die from it than people of any other racial group. Sadly, many of us became aware of this when our beloved actor, the Black Panther Chadwick Boseman, passed from colorectal cancer. It is a horrible disease that is taking a toll on our community. So, what can you do? If you are at average risk of colorectal cancer, begin regular screening at 45. If you're at higher risk, starting your screening earlier may be what's right for you. How do you decide? Talk with your doctor to find out what's best for you. When you should start regular screening and ways to reduce your risk. Remember, preventing cancer and finding cancer early are steps we must take to improve our own health and the overall health and well-being of our community.
Great evening. Please note that I said great instead of good evening because this is a very special evening. The American Cancer Society is launching an initiative that will make a huge difference in the lives of many people, certainly in this country and elsewhere. I am Charlie Hill of the International Health and Wellness Committee of the 100 Black Men of America. Our organization is committed to using voice and influence to increase awareness of prostate cancer, which threatens and drastically impacts men and their families. It has been said that Black people live sicker and die younger than any other racial group in the United States. To be sure I have your attention, I will say this again. Black people live sicker and die younger than any other racial group in the United States. Many of us are all too familiar with the impact of cancer on our communities, families, and other loved ones. When it comes to prostate cancer, approximately 1 out of 7 Black men will be diagnosed with the disease, and sadly, Black men die at more than twice the rate of other men. This is the largest racial disparity for any type of major cancer for men and women. Yet there is a significant knowledge gap in our community when it comes to prostate cancer, and we know that knowledge and access to quality care are critical to changing the impact of prostate cancer on Black men. We need our men and other leaders, physicians, clergy, and the entire community, especially women. We need all of these people raising awareness regarding the importance of Black men getting tested and examined for prostate cancer starting at age 40 to at least collect some baseline information for themselves and their doctors. We must address the barriers to Black men getting tested and examined regularly and early enough to be successfully treated. Please join us as we partner for life to help increase awareness, educate on ways to detect and treat prostate cancer, and advocate for guidelines and practices that ensure Black men have access to early detection and clinical interventions that will lead to better health outcomes. I thank you for your time and attention.
Thank you, Dr. LeBlanc. Thank you, President Roy and Mr. Hill, for sharing your why. You see, it's the why that is just so important, and thank you for reminding us of that. Now, let's get ready to hear from one of gospel legends, Miss Dottie Peoples, because we all love her for her hits like He's an On-Time God and He Can Work It Out. Ladies and gentlemen, Dottie Peoples.
God bless you. I'm Dottie Peoples. And 2015 was a year I will never forget. My mom was diagnosed with cancer. 2016, my mom passed. But let me tell you one thing. Through all of the caregiving and everything that we had to do, there was one thing I always remembered in my mind. God had the last word. And I hope that this song right now will bless you. God has the last word.
Searching for answers. You're asking here and there, trying to solve your problem, but it seems like no one cares. You may have fasted, and you may have prayed, but when you got up off of your knees, seems like all of your problems decided to stay. It may look like the end, but God has the last. He has the last word. Sometimes you feel like you're the only one that is going through. I've even asked myself, does God really know what I'm going through? Then I know no weapon formed against me shall prosper. And I know He'll never put more on me than I can bear. But if God brought me to the problem, I know He'll bring me through it because He cares. It may look like the end, but God has, He has the last word. Be strong. Keep the faith. Stay the race. Oh, it may look like but God has. He has the land. Oh, yes, he does. Let me tell y'all something tonight. You know what? Delay doesn't mean deny. Hold on. Be strong. 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 Hold on. Be strong. Hold on. Hold on. Be strong. Hold on. Be strong. Hold on. Be strong. Hold on. Be strong. Don't worry about the problem. Just hold on. It may look like the end, but just hold on. Hold on. Hold on. Your victory is coming. It's just a testimony. Hold on. Hold on. It may look like the end, but God has. He has the last
Yes, hold on, hold on. Thank you so much, Dottie. Thank you. And we know indeed that God has the last word. Amen. Okay, because he always provides resources to meet every need. Now, if you or a loved one want to know more about cancer prevention and early detection, or have been recently diagnosed or going through treatment, or anything that you might need, just know that the American Cancer Society has resources for you. Reach out any time of day or night by calling 1-800-227-2345. That's 1-800-227-2345. Or you can visit cancer.org/partnering for life. Now, free lodging for cancer patients, a live helpline, free rides to treatment. We are all working every day to make a difference. All right. So now let's hear from more partners that are joining us in this fight. Please join me in welcoming Bishop Harry Seawright and Bishop Francine Brookins of the AME Church, and Mr. Reuben Shelton, Grand Polemarch, Kappa Alpha Psi Fraternity Incorporated. Thank you.
Hello, I am Bishop Harry L. Seawright of the 9th Episcopal District of the African Methodist Episcopal Church. We are delighted to be in partnership with the American Cancer Society and our fellow organizations committed to addressing the health and wellness needs of our communities. The mission of the AME Church is to minister to the social, spiritual, and physical development of all people. It is our duty to equip our people with the information and tools to live the lives God has called them to. We know that Scripture tells us that God has called us to prosper and be in good health. As the body of Christ, we can do all things that align with good health, like eating healthy, exercising, and getting screened for cancer. So I call upon each of us to honor God with our bodies so that we might have abundant lives as we contribute to the building of God's kingdom.
Greetings and blessings of peace, power, and protection. I am Bishop Francine Brookins of the 18th Episcopal District and the chair of the International Health Commission of the African Methodist Episcopal Church. The International Health Commission is excited about many years of partnering and working with the American Cancer Society and this partnership with organizations coming together to address cancer prevention, awareness, and health advocacy. The mission of the International Health Commission of the AME Church is to help the denomination understand health as an integral part of the faith of the Christian Church. The Commission is committed to empowering church leaders and congregations with evidence-based research, including the benefits of lifestyle medicine and plant-based nutrition, advocating for improved access to affordable and quality health care, providing health education, and collaborating with ecumenical and interfaith health projects to fight and prevent cancers and other chronic diseases. The Reverend Dr. Natalie Mitchum, our Executive Director, the Reverend Dr. Miriam Burnett, our Medical Director, and I invite you to partner with the American Cancer Society and enjoy tonight's Partnering for Life Gospel Concert.
Good evening. I'm Reuben Shelton, Grand Pole Mark, or President of Kappa Alpha Psi Fraternity Incorporated. Our fraternity has a rich history of impacting the needs of our local communities and places around the world. We recognize that as we engage our communities through service, charitable giving, and programmatic work, each of us must prioritize our own health and well-being to be of service to others. To that end, I encourage all of you to reduce your risk for cancer by healthy eating, active living, and following the American Cancer Society's cancer screening guidelines. Research has shown that a bad diet and not being active are key factors that can increase a person's cancer risk. But the good news is that we all can do something about it. It is imperative that we have regular visits with our healthcare provider, so we are taking the necessary steps to ensure good health. As husbands, fathers, brothers, and sons, our families and communities need us healthy and strong. So please join me and the men of Kappa Alpha Psi as we partner for life with the American Cancer Society to take charge of our health by getting screened for cancer, eating better, and being active. Let's do it for ourselves. Let's do it for ourselves. But more importantly, let's do it for our loved ones. Thank you.
And thank you to all of our partners for those important messages. Now, we know that cancer affects everyone, but it affects everyone differently. And it affects us equally as well, which is why we are all here tonight, to lift up the stories and the things that we can do, because this is about action to fight cancer. Now, lending her voice to this fight is one of my favorites, multiple Stellar Award winning, and Dove nominated gospel artist, Marette Brown Clark.
Hi, my name is Marette Brown Clark, and I want to make a minute to thank the American Cancer Society for having me for this great event on today, the Partnering for Life Call to Action concert. I don't think that there's anyone in the world whose life has not been impacted by cancer, either a self-diagnosis, a family member, a friend, or someone that you know. Certainly we appreciate the work and we celebrate the work that the American Cancer Society does, and it is important. We can do it. You can do it by lending your talents, your time, your gifts, your money to help fight cancer. Thank you again for having me. I really appreciate this opportunity. And I pray that something that I say, something that's done on today, that is sung, is a blessing to somebody who is watching. You be encouraged and you be blessed.
Let's go. Song says, you are the God who can do miracles. You are the God who can do miracles. You are the God who shall prevail. who's able to keep me. You are the God who's able to keep me. You are the God who never fails. You are the God who never fails. I put my trust in you. 'Cause you're the same yesterday and forever. I can't see my way through. Listen, I don't know how, but it doesn't matter. I am so confident, and I am so convinced. I am so absolutely sure that you'll come through for me. I am so confident, and I am so convinced, and I am absolutely sure. You never let me down, and you never will. Stay. You never let me down, and you never will. You never let me down, and you never will. You never let me down, and you never will. I am so confident, and I am so convinced. I am so absolutely sure that you'll come through for me. And I am so convinced, y'all. And I am absolutely sure. Oh, you never let me down, and you never will. Oh, yeah. You never let me down, and you never will. You got me now, right? Listen. I am so confident, and I am so convinced. I am so absolutely sure that you'll come through for me. And I am so convinced, and I am absolutely sure. Yes, I am. He never let me down, and he never will. God's never let me down, and he never will. Oh, listen, he never let me down, and you never will. Say, you never let me down, and you never will. You never let me down, and you never will. Not one time, not one time. You never let me down, and you never will. Oh, God, I can count on you. You never let me down, and you never will. Hey, thank you, God, thank you, God. You never let me down, and you never will. Hey, you never let me down, and you never will. Say, you never let me down, and you never will.
Wow, that was simply amazing. Give it up again for Maurette Brown Clark. Thank you so much. Now, next, I want to introduce Victoria Kirby York. She is the Deputy Executive Director of the National Black Justice Coalition, and she is here to share with us the impact of cancer on our brothers and sisters that are in the LGBTQ community. So following Victoria, we're going to also hear from someone who knows firsthand what it is to hear the words, "You have cancer." Now, sharing his story to let us all know that you can survive and you can thrive after a cancer diagnosis is Rick Rivers. Thank you.
Greetings. My name is Victoria Kirby York, and I have the privilege of serving as the Deputy Executive Director at the National Black Justice Coalition. NBJC is the nation's leading civil rights organization focusing on the rights of Black, lesbian, gay, bisexual, transgender, queer plus, and same gender loving people. I have a very important question to ask you all. When was your last cancer screening? This is a very important question, and a question that far too often members of the Black LGBTQ plus and same gender loving community are never or rarely asked. Some of this comes from physicians not being culturally competent or comfortable talking about the healthcare needs of members of our community. particularly trans men who might need breast cancer screenings, cervical cancer, uterine or ovarian cancer screenings, or prostate cancers for same gender loving men and transgender women, as an example. And all of the above when it comes to non-binary and gender non-conforming folks. It's important that each and every person is asked about screenings every time, especially if you have a family history of cancer. Too often, healthcare becomes a family secret, and we have to stop that now. Healthcare is for your entire family to be able to ensure that the next generation doesn't fall victim to the same disproportionate rate of cancer. We can stop it together by bringing that history to the light. We know that early knowledge that you have cancer increases survivability. So ask your friends, ask your loved ones, especially those in the LGBTQ+ community, when was your last cancer screening? And ensure that each and every one are regularly getting it done. And for those of you who are part of the American Cancer Society and other organizations push to support those who are battling through cancer, please remember LGBTQ+ elders in your community. For many of them, family rejection at a time when our community was less accepted means that many of them are battling this illness alone and would welcome your friendly face and your support. We can also do our part to ensure that our physicians are as culturally competent and comfortable as possible when treating members of our community. We can ensure that we all get free from the disproportionate impact of cancer in the African American community. And in order to ensure that all Black lives are being as preventative as possible, it means we have to include all of us, including our queer, trans, and non-binary siblings. Thank you for your support, for your allyship, and for continuing the fight for all of us. We will eradicate cancer together.
My family means the world to me. Probably the reason that I've survived everything that I have. If it was just me, I may not have made it this far. Every challenge that I come up against, I have their love behind me, pushing me forward. There's nothing that I have encountered yet that has been able to stop me with them by my side. My name is Rick Rivers, and I've been diagnosed with both colon cancer and with kidney cancer. I've had a family history of colon cancer going back at least 2 or 3 generations. I did not hear about cancer when I was younger, not in my home. The big focus was on diabetes, but not so much cancer. I really didn't have any conversations about cancer. A lot of men are not diagnosed as early, and that is due to not having proper screening. Maybe a lot of people are believing that if I don't test, maybe I won't have it, but that's just, the ignorance of bliss. And so a lot of men, especially Black men with a family history of colon cancer, should get scanned very early on. I think one of the big hurdles with getting screened for colon cancer, biggest one is fear. It's the biggest one. Nobody wants to hear that. And if you don't ask, then you don't get the answer. But you have to get past the fear factor. So it's one thing to be scared to hear something. It's another to die from not hearing something at all. I think one of the big hurdles of the conversation not being had regarding screening, especially colon cancer, is that it's kind of taboo. I mean, it's kind of hard to talk about anything in that private realm, and people usually shy away from it. If you're somebody who has a platform in your community that can address men in your community, then it is your responsibility to let them know that this is something that they should be doing. And once they hear the conversations, once they hear that it's okay, once it becomes normalized, it's not a taboo subject anymore, and then we can have it without problem. Because colon cancer is a generational issue with my family, I inform my boys almost every day. So it is a constant idea in their mind. It's also important for me to let them know that the possibility of them getting cancer is a real thing, so that in the future, when it's time for them to begin getting testing, they will talk to their doctor. They will let their doctor know, hey, my dad had colon cancer. What can I do to ensure that my odds of getting it are as low as possible, so that, God forbid, if they do get it, they'll know what to do. And if by that time that happens, hopefully there'll be more research into it, better medications, and if not, maybe even a cure. I want to be someone who builds a legacy for my family. I am now cancer-free as of this day, and I am thankful for that. I am a lucky man.
God bless you. I'm Dottie Peoples. And I just want to tell you, I got a dad. He's 93 years old. And in a few months, he'll be 94. But being a caregiver for him has been a joy for me. He had cancer, and God cured him of that cancer. But you know what? I want you to just listen to this song that we're getting ready to do. And it says, God can and he will fix it, because he fixed it for my dad. He'll fix it for you. God can and he will fix it. I hope it blesses you.
How many of you know that God can? He'll fix it for you. I don't care what you're going through. God can fix it. I'll tell you.
Yes, God can fix it, fix it, fix it. Thank you, Dottie Peoples. And thank you so much, Rick Rivers. Thank you so much for your powerful testimony. It really stirred my soul so much. What a powerful reminder that we can survive cancer. Yes? Okay, and by talking with our families and getting screened, we can also take charge of our health, which is so important. Now, we are blessed to have so many amazing friends and partners supporting us with this work. And joining us now, we have Reverend Dr. Miner, the National Director of Hope, Health, and Human Services Partnership for National Baptist Convention USA, the International President of Zeta Phi Beta Sorority Incorporated, Valerie Hollingsworth Baker, as well as the National President of the Links, Dr. Kimberly Jeffries Leonard. Thank you.
Good evening. I am Reverend Dr. Michael O. Miner, National Director of the Hope Health Ministry of the National Baptist Convention USA Incorporated. Our denomination is committed to inspiring and empowering individuals to commit to healthier lifestyles. To that end, we have been partnering with the American Cancer Society for over a decade to educate, share life-saving resources, and to train health ministries to reach the communities with cancer prevention and early detection information. We believe God has caused us to be good stewards of our health. So we encourage you to understand your risk for cancer, to recognize the signs and symptoms of cancer, and to have a relationship with a trusted healthcare provider. Taking charge of your health means that you are in partnership with the healthcare provider to discuss which cancer screenings are right for you and when you should start screening. It means working with that healthcare provider to understand the importance of good nutrition and physical activity in reducing your risk for cancer and other diseases. The Bible reminds us of the importance of knowledge. So we want you to be knowledgeable about cancer prevention and early detection. So please visit cancer.org/partnering for life. There are resources on the page for individuals, houses of worship, and communities designed to educate and help us improve health outcomes in our communities. Check out the resources and share them with your loved ones and those in your network.
Good evening. My name is Valerie Hollingsworth Baker, and I am the 25th International President of Zeta Phi Beta Sorority Incorporated. Since our inception, Zeta has implemented programs designed to demonstrate concern for the human condition, both nationally and internationally. Cancer is one such issue. Through Zeta's partnership with the American Cancer Society, we have worked to support cancer research and advocacy. We have provided resources such as wigs to women facing cancer. We also collaborated with the American Cancer Society to raise awareness about triple-negative breast cancer, which a recent study found that Black women have nearly a 3-fold increased risk of triple-negative breast cancers, which often have poor outcomes. Triple-negative breast cancer is a more aggressive and often affects younger women. Studies also show that when facing a triple-negative breast cancer diagnosis, Black women are less likely to receive standard treatments. For these reasons and others, Zeta Phi Beta Sorority is partnering with not only the American Cancer Society, but other organizations serving the Black community to raise awareness and action to address these alarming statistics. Therefore, we need to take action with our own health and to share life-saving cancer information with your loved ones. So let us continue to work together so we can finish this fight against cancer.
Hello, I am Dr. Kimberly Jeffries Leonard and serve as the 17th National President of the Links Incorporated and the Links Foundation Incorporated. Since 2015, the Links Incorporated has worked with the American Cancer Society to address cancer disparities by educating communities and providing much needed resources to drive cancer prevention and early detection. We have trained more than 300 members of our organization to serve as health equity ambassadors to work directly in communities across the country. As Black women, we are keenly aware of the impact of breast cancer on our communities. While Black women and white women get breast cancer at about the same rate, Black women are 40% more likely to die from it. Let me say that again. Black women are 40% more likely to die from breast cancer than white women. This alarming statistic is why we are partnering for our lives. Our communities and families have felt the devastating burden of this statistics. It is a rally cry for action, action that calls us to first know the facts. Black women must understand their risk for breast cancer so that we can educate ourselves and be proactive about our health. We must get screened. Early detection saves lives. Too often, we are diagnosed at later stages, which leads to worse outcomes. Talk with your doctor about getting regular breast cancer screenings. If you're nervous about getting screened, bring a friend for moral support, then go with her for her breast cancer screening. Letting go of fears and myths that may get in the way of being screened is critical. This pandemic has resulted in delays in cancer screenings that will increase the burden of cancer in our communities. But you can get your mammograms in a way that is safe by wearing a mask, practice social distancing, and using hand sanitizer. Finding a trusted healthcare provider can help lessen your fears and assist you in maintaining your health. Finally, know that the American Cancer Society is a resource for you. They can help you find free or low-cost breast cancer screenings in your local community. Take charge of your health by getting screened and helping a friend get screened too.
I know the odds look stacked up against you. It seems there's no way out. And I know the issue seems unchangeable. And that there's no reason to shout, but the impossible is God's chance to work a miracle. Yes, a miracle. Just to know it ain't over until God says it's over. It's not over, no, until God says it's done. No, 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 it ain't over until God says it's over. Keep fighting until the victory is won. Oh. You're a winner in the end. See my God defeated. Oh, your enemy way before this fight began. Yeah. Right now the impossible. God's opportunity. Yes, it work a miracle, so just know it ain't over until God He does. He will free you from your sin and give you peace within. So you better hold your head up high. You're gonna win. Yes, you're gonna win. 'Cause it ain't over until God says. It ain't over until God says it's done. Oh, it ain't over until God says it's over. Here's what you gotta do. Keep fighting. And you better keep praying. Keep fasting. It ain't over. No. Keep pressing. Progressing. Keep moving. It ain't over. No. Keep reading. Interceding. My God. Keep on believing. I believe the report of the Lord. And it says it's not over. Not over. Not over. Keep trusting. Keep trying. Travailing. It's not over. No. Keep living. Keep giving. Oh my. Keep going. Hey. It's not over. No. Ask me how I know. 'Cause I should have been. Come on and count it out a long time ago. But my Savior, He saw fit to give me another chance. So I thank Him right now. I praise Him right now. I lift Him up now. I give Him the glory now. 'Cause it's not over. And if He did that for me, He can and He will do the same for you. Oh no. Keep fighting till the victory is won.
Wow, it ain't over. Thank you so much, Moret, for that wonderful and powerful word. And I've been reading the comments in the chat section. So please continue on to do that and be a blessing to us. What a word. Now we know it ain't over, okay? And that's why we are all here right now, partnering together for life. So here is a testimony from someone who truly knows that it ain't over until God says it's over.
My husband and I did not set out, to raise a professional athlete, and that at any time was that the focus. It was raising responsible citizens. There are so many values as a mother that you try to instill in your family, in particular, just being a good person, having the values of integrity and honesty. Personal experience with breast cancer was 2011. My doctors thought it was calcification, wanted to take a second look, and was really shocked to get the call that cancer had been detected. I was diagnosed with ductal carcinoma in situ, which is referred to as DCIS, also called stage 0 breast cancer. I would have to have surgery, lumpectomy, 6 weeks of radiation, and potentially 5 years of tamoxifen treatment. After the shock, it was very important to just have a positive attitude and outlook on the treatment, had the lumpectomy, the radiation. It wasn't a pleasant experience at all, but what was important about my journey is I had the support of my family and friends, my husband, to take me to the treatments and just to be there for me. My faith was strong. I consider myself the healthcare CEO of my family in making sure that everybody's eating right, making the best choices when it comes to food selection, what we're putting in our body, the importance of exercising, but also the importance of checking in with each other and having close connections with each other, which plays into your mental health. If I had not gotten my routine mammogram or had skipped it, or my doctor was not as attentive, my outcomes may have been a lot different, and I may have been one of the statistics that we unfortunately know about. We'll encourage someone not to be fearful of learning, even if it is a positive detection of cancer, not to be afraid. That is something that is survivable, especially with early detection. I know early detection saved my life, and this is why I share my journey and my story of early detection with everyone that I know and everyone who knows me.
Wow. Thank you so much, Gwen, for what a powerful testimony. And thank you for sharing your story. Now, we are all again reminded of the courage and the strength of our survivors, that when facing a cancer diagnosis, it's really challenging. And in addition to their resilience and their strength, they are often supported by family members and loved ones, and they're also supported by caregivers who provide encouragement and support that carries them through. So today, we celebrate our caregivers, and we are so thankful for you. And as we enter this holiday season that is coming up, when families are gathering, let's also remember to show all of our caregivers just how much we appreciate them. So let's also remember that the holidays are also a wonderful time where we can celebrate survivorship, and we can also think about preventing cancer. So as we also step forward, we must also take an individual look at ourselves as well as our families and remind ourselves just to stay healthy. Because there is a way for us to prosper and be in good health, and here to remind us of that, and here to remind us really that there is a way giver and a way maker, and is a longtime friend and supporter of the American Cancer Society and one of gospel music's greatest. Please welcome Patrick Lundy and the Ministers of Music.
Come on, everybody, put your hands together. How many of you know he's a way maker? I said, how many of you know he's a way maker tonight? Way maker. God, he's a way. Way. God, he's a way. You can't. I know. Say it one more time. Way! God, he's the way. Hey, yeah. God, he's the way. You can. I know. Yeah. Listen. If you are in sin, God will be with you wherever you go. If your body's sick and in pain, you will be healed in Jesus' name. God is the way. God is the way. You can't. I know. Yeah.
Hello, I'm Dr. Willis Lonzer III, General President of the Alpha Phi Alpha Fraternity Incorporated. The men of Alpha Phi Alpha, the men of distinction, are pleased to join you this evening as our fraternity understands all too well the health concerns plaguing our communities. The recent deaths of celebrities such as Chadwick Boseman and Virgil Abloh and the alarming cancer disparities that exist call us as individuals and organizations to raise the consciousness of our communities so that we can improve our individual and collective health. That is why in Alpha Phi Alpha, I appointed our very first Surgeon General to help marshal our efforts to improve health outcomes for our brothers and our communities abroad. In my professional life as a regional medical director, I know that one important step in this regard is to understand your health history. Knowing this can reveal the history of disease in your family and allow you to identify patterns that might be relevant to your own health. Learning from your family's medical history can help you understand what lifestyle changes and health behaviors are important to you. So as we gather for the holidays, take time to have these conversations with your loved ones. Your family's health history can't predict your future health, but having this information in your arsenal is one weapon in the fight to live a long, healthy life, which is one of the greatest gifts we have.
Wow, thank you so much. And as we celebrate the greatest gift, let us always remember that there is a reason for this season. And here to also help us in reminding us of that is a group that is very near and dear to my heart. These young people have been a part of my life for, as long as I can remember. 25 years, I co-founded the Amazing Grace Conservatory. And here to give you a sneak peek of our upcoming production of A Soulful Christmas, please join me in welcoming the youth of Amazing Grace Conservatory singing Mary, Did You Know?
One day walk on waters. Mary, did you
Wow, what a wonderful presentation. I am just so honored to have been with you this afternoon, this evening, and I'm just praying that God just lifts up everyone and we do find a cure for cancer. And thank you to the Amazing Grace Conservatory. That's my ministry, my passion, and I hope that you were touched by it. What an amazing evening we've had. We've had so much information, education, as well as wow, inspiration. I really prayed that you were as inspired as I was. So we hope that you will take this knowledge that you have gained and not only apply it to your life, but also share it with someone. Share it with someone else, because together we can keep the conversation and the action going to help our loved ones live healthier lives. It's truly been my pleasure to serve as your host and to be the ambassador for such an incredible event. And more importantly, it is my pleasure to continue on with the fight as an ambassador for the American Cancer Society. Now, we are committed to advancing health equity as well as saving lives. So here to close out with us is the Reverend Tawana Thomas Johnson. And I'm so sorry because she has been a gem in my life. And I just have to acknowledge her and thank her so much for not only being a present with the American Society, but also being a presence for me throughout this. She is the Senior Vice President and Chief Diversity Officer for the American Cancer Society. So please join me in welcoming her. Thank you.
Thank you, Wendy. We are so blessed to have you sharing your time, treasure, and talent to help bring this initiative to fruition. We appreciate all you are doing to raise awareness and to save lives from cancer deaths, which in many instances are preventable. Thanks also to our partners, artists, and volunteers who have come together for such a time as this to call us to action. This call is so very timely as we honor and celebrate the life of one of our greatest creatives, Virgil Abloh, who, like so many others, was taken from us too soon. Let's honor his legacy by committing to doing all that we can to inform, educate, and inspire others to prevent cancer and find cancer early so that we can live the lives we've been purposed to live. Maya Angelou once said, "When you know better, you do better." Beloved, let's do better. Let's educate our people. Let's fight back. Let's get screened. Let's partner for life. And let's heal our communities.
Come on, raise it up, everybody. Clap your hands. Come on, here we go. Got a story to tell about some things that I've been through. But come on, raise it up. Dion, come on up, man. Oh, I will. JJ, come on. Had some ups and some downs. But I'm healed. But I'm healed. Oh, I'm healed. Oh, I'm healed. Come on, say it. Wrestle all night. Wondered what went wrong. I can't hear y'all. Come on. But I'm healed. Oh, I'm healed. Oh, I'm healed. Had some sunshine. Heartache and some pain. Heartache and some pain. I'm healed. Oh, I'm healed. Come on, my God has touched me. My God has touched. Know and delivered. He set my soul free. He set my soul free. My heart is mended. My heart is mended. And I'm whole again. I'm whole again. No chains. No chains are holding me. Got my liberty. Got my liberty. Up in the house tonight. I'm healed today. They have some scars. I am healed. Circumstances say I'm still healed. Disappointment, say it.